Hello and welcome to the New Hampshire Insurance Department's monthly webinar. This month we'll be dealing with our legislative wrap-up. And as always, if you have questions, we would like to entertain those at the end, so please type those into the chat box and we will address them at the end. And you can check out this and all of our webinars on our YouTube channel, so be sure to stop by our YouTube channel for all kinds of informative videos. Without further ado, I'm happy to introduce our Commissioner, DJ Betancourt.
Well, thank you so much, Andrew. First and foremost, can everybody hear me all right? Lovely.
Yes.
Seeing a lot of heads going up and down in the affirmative. That's great. So first and foremost, my apologies. I had a doctor's appointment run late, so I am conducting the webinar from my car. But the New Hampshire Insurance Department's webinars, the show must go on at all times. So we'll persevere through. Again, appreciate you all joining us for our monthly webinar series. As Andrew mentioned, my name is DJ Betancourt. I have the pleasure of serving as the Commissioner of the New Hampshire Insurance Department. And this month, we are obviously focusing in on the legislative wrap-up. Now, I know that this webinar is always an industry favorite, but we obviously hope that consumers and producers have joined us as well, or they will catch this program at a later time, because the changes that are being made to state law that are going to take effect in January have an impact on the insurance laws in how all of those individuals in this industry, as well as the public, are going to be impacted. So for any of you who followed the legislative session that wrapped up in June, you will know that it was a very, very active session. And so one of the most challenging parts in preparing for this webinar was to pick the most impactful pieces of legislation to highlight. I think that if we attempted to cover all of the proposals impacting some aspect of insurance, this would be a 2-hour program. And Andrew and AJ have said we can't do that. People will stop watching. It gets boring. So I really did try hard to focus on what I thought were some of the big changes that are going to take effect in the new year. But obviously, at the end of my presentation, my team will have an opportunity to share anything that they feel that I've missed, that all of you should know. So as I said, we were very, very busy. And before we begin the formal presentation this afternoon, I did want to take a moment to thank the members of my team who worked incredibly, incredibly hard this winter, spring, and early summer. First and foremost, I want to thank Jennifer Smith, who is our new legislative director, who came in this past winter and really dove into things, really did a phenomenal job of keeping us organized and keeping all of us in the hearing rooms that we're supposed to be in at the time we're supposed to be there, as well as tracking all of the various pieces of legislation through the process. I also want to thank Michelle Heaton, our director of the Life and Health Division, as well as Jason Dexter, our Assistant Commissioner, Keith Nyan, our Deputy Commissioner, Dr. Azz, the head of our Data Analytics Unit, as well as James Fox, the head of our Property and Casualty Division, Emily Dory, our head legal beagle of the P&C unit, amongst many, many others. They all did a phenomenal job of getting the legislature the information that they needed, whether that be answering inquiries, whether that being helpful in drafting amendments, whether that be reviewing their pieces of legislation up front to avoid having to go back and rewrite them later, or to have to put amendments on later. The team worked really hard, and I'm very, very thankful for all of the efforts that they put in. So as I said, here are my top 5 most important bills, changes that you should know as we go into the new year. And I will start first with life and health bills. So first is the passage of Senate Bill 173, which I believe is a pivotal piece of legislation aimed at fully ensuring that consumers are protected from unexpected medical bills. So put simply, this bill ensures that the state level balance billing protections align with the federal No Surprises Act, such that consumers, whether they have a fully insured or self-insured health insurance product, they're going to have the same level of protection against balance bills. The passage of this bill reflects the 3-year culmination of hard work by the department, and frankly accomplishes one of my top priorities as commissioner, which again is to ensure that regardless of the type of health insurance coverage the consumer has, they are protected from those surprise medical bills. I think that in keeping with the New Hampshire tradition, our independent dispute resolution process is going to be far more efficient, far faster, far more sensitive to the needs of the parties involved than the federal system currently provides. So we're obviously excited about that. I would note as well that the bill expands the definition of emergency services to match the No Surprises Act definition and includes provisions of timely payments for health carriers to out-of-network providers. That's simply, of course, what it puts, but that definitional change is very, very important. And importantly as well, we know that the Centers for Medicare and Medicaid Services has said that this bill is acceptable to them, that we're going to be able to work very closely with them and to dovetail our collective efforts to enforce prohibitions against surprise medical bills. I'll stop at this point and simply ask Michelle Heaton if there's anything related to Senate Bill 173 that she would like to highlight that I might have missed.
Nope, I think you did a great job. I'll just throw out there that we are working on drafting some proposed rules and some guidance for how this process is going to work. And we're hoping to get those out soon for everyone.
Awesome. And that will be, by the way, a recurring theme that I'll get to at the end of the program, which is while the legislative session might have wrapped up in June, there has been plenty of summer and fall homework for the department to do. And I'll get into some of that work at the end of the program. But I appreciate you highlighting that, Michelle, and we'll get more into that as we go. The second bill that I would highlight is the passage of Senate Bill 561, which deals with prior authorizations for health insurance coverage. And so this bill establishes a clear criteria for prior authorization in health plans and streamlines access to necessary medical treatments. The department, I'm proud to say, played a pivotal role in working with Senator Ricciardi in a very wide diversity of stakeholders. I think we did a great job of coming together with advocates, with healthcare providers, with health insurance carriers, as well as policymakers to find a great solution to some of the hiccups in the prior authorization system. So those changes will take place again in the new year. Two big highlights that I would make reference to here in terms of what the bill is going to change. The first is it's going to address wait times, and specifically it addresses the turnaround times with deadlines in place for prior authorization to ensure that access to care for the consumer is not being needlessly delayed. I think that's something, again, that everybody did a good job of compromising on, and that's obviously a huge win for the consumer. The second thing that it does is it addresses prior authorization reviewers and the qualifications of those individuals who are doing the review of the prior authorization to ensure that on the one hand, the system isn't getting bottlenecked or slowed down as a result of these changes, but also ensuring that the individual at the health insurance carrier level is someone who is qualified to be able to make a judgment on whether or not that prior authorization is appropriate when interacting with the provider who has requested that authorization. So we're making sure that somebody who is in need of a heart procedure is going through the process of that prior authorization, getting that prior authorization, that the consumer's health provider is talking to someone at the health carrier level that it is also someone who understands cardiac medicine. And so again, we hope that that is going to streamline that process, make it go much faster so that we're not delaying that critical access to care for the consumer. So Michelle, I know it did a number of other things. Those were the two big ones, at least in my mind. Again, opportunity for you to add anything that you feel I might have missed.
Yeah, I think one of the big things for this bill too is that if those deadlines aren't meant for prior authorization, the patient will still have access to those services, even if it hasn't been granted. So it kind of automatically grants it if those deadlines are not met. Again, this is some big changes to prior authorization, and we're currently working on revamping our utilization review rules so that all of these new criteria are addressed in those rules as well. So we're hoping to get those draft rules out soon.
Awesome. Thank you, Michelle. Very important point. I appreciate it. The last life and health bill that I would highlight is House Bill 1296, which deals with insurance coverage for diagnostic and supplemental breast examination. And this ensures that there is going to be insurance coverage for diagnostic and supplemental breast examinations. There should be no question about that. Consumers who need that care are going to get that care. And it really does, I believe, underscore our department's commitment to women's health. The department worked very closely, again, with legislators and with providers and with health carriers to get a good piece of legislation for the consumer. And for us, it's all about ensuring early detection and comprehensive care for breast health. So I felt that one was important to highlight as well. So, Michelle, again, I'll turn it back over to you. Anything you'd like to share with regard to House Bill 1296 or any other life and health bill this session that you think should be highlighted?
So the key thing about this bill in particular is that it requires no cost sharing to the patient for some of these services. So that's key, especially in breast cancer. Sometimes, the preventative screening is covered with no cost sharing, but if something is flagged on that requires further follow-up, patients will be able to access those without having to have any cost sharing, which is key for people with low income who are on, fixed budgets. Coming up with those co-pays or deductible can be hard for some people, and it does discourage them from getting those follow-up testings, which, in the case of breast cancer, the sooner you can find it, the better the outcomes for patients. So those are some really good strides in the right direction. So we're excited to be part of that. I think there were a lot of bills that we covered over this session. I think you did a good job of highlighting them. If anyone has any questions about the bills that have passed or how we're implementing them, please feel free to reach out, and we're happy to talk you through any of those issues or questions. I know we are working on a lot of guidance for a lot of different pieces of this legislation that has been passed. So you'll see a lot more coming from us in the next couple months.
Thank you so much, Michelle. Really appreciate that. So those were three life and health bills that I felt were important to highlight. Now over to property and casualty. And the first bill we definitely want to talk about is Senate Bill 515, a critical piece of legislation aimed at enhancing consumer protections with regard to consumer guarantee contracts. I understand that we've talked about this before. I think, in fact, we've done an entire webinar on this before. But as we said when we did that webinar, we were seeking additional consumer protections, and we were successful in getting those protections from the legislature. So it introduces some key revisions to consumer guarantee contracts to ensure greater transparency for consumers and to provide the department with more robust enforcement measures against the bad actors in the industry. And I want to pause at this point to say that I really appreciate a lot of the companies that offer these particular products that came to us and said, we want to work with the department to advance some of these reforms. We want to ensure that the bad actors are not ruining the reputation of not only our company, but also the value that these products have to consumers. And so they were a huge help and asset as we put this bill together. So among other things, this legislation ensures obligors provide comprehensive information, including certified copies of their charters and bylaws and updated contact information for all of the administrators and sellers, so we know who are selling these products, and if there's an issue that comes up with them at the consumer level, who either the consumer or the department needs to reach out to resolve those issues. And finally, the bill outlines prohibited practices, including false or misleading statements, pressure tactics, and discriminatory practices, again, in the realm of their marketing strategies and their marketing practices. That was a huge problem we were seeing, and we understood that we needed to take some steps to ensure greater consumer protection, but especially for vulnerable seniors, who we found were more susceptible to some of the outrageous practices that we were seeing. So we now have those protections in place to a greater degree that obviously guards against financial exploitation of seniors and really for all consumers ensures fair treatment in the claims handling and contractual settings, again, around things like cancellations and things of that nature. So we're very, very proud of the work that we did on that bill, and we're looking forward to that bill taking effect again come January. The last bill that I would highlight is Senate Bill 462, a bill that raises the caps on damages for wrongful death, loss of consortium claims. The bill raises the cap for surviving spouses from $150,000 to $500,000 and the cap for surviving children from $50,000 per child to $300,000 per child. Now, as those of you who may have followed a little bit of the legislative session this year know, this was not legislation that the department was supportive of. Many industries are feeling the pressure of increased insurance rates. And a lot of the things that one of the major factors driving those increased costs is litigation. The cost of litigation is felt in your premiums. And so we were concerned about the impact this bill might have on a market that's going through some challenges right now. And so we did not feel that this was the right time for this piece of legislation. However, the legislature decided to move forward with it and the governor signed it into law. And so we as a department are obviously going to pay close attention to the impact that the bill has on insurance premiums. And we will report back to the legislature and other policymakers what consumers are experiencing. And at that point, they'll have the policy decision to make as to what they want to do with that information. But in the property and casualty space, we know that that was a bill of significant concern this session, and that's ultimately where it landed. So I'll stop at this point and again turn to my team to say, those were my five. Is there anything that you feel that I've missed that should be highlighted? All right, sounds like they feel like I hit kind of the sweet spot. So I appreciate that very, very much. So as I mentioned in reaction to a great point that Michelle made earlier, while the legislative session did end in late June, there was a lot of work that flowed from the legislative session that has continued throughout the summer and the fall, and some of it is still going on now. And so I would note two things in that regard. The first is, as you know, when legislation passes, there's a lot of things that go into successful implementation of the policy objective that the legislature and the governor had in mind when that bill moved forward and ultimately becomes law. And part of that is the rulemaking process. Part of that is the department issuing bulletins or issuing other kinds of guidance to industry, to the public, to producers, whoever is impacted. And so I did want to highlight, as Michelle started to do, that the department is in the process right now of putting together new rules to support our new balanced billing prohibition protections. So there'll be rules, there will be a bulletin, and there will be guidance. Senate Bill 173 is going to hit the trifecta there. What I would say, though, not only for this particular piece of legislation, but for all of the bulletins, rules, and guidance that come out as a result of these proposals becoming law, we will follow the same process we always do, which is prior to us putting the rule before the legislative committee in charge of approving those rules, whether before we issue the bulletin or the guidance, we will make that available to the industry to review and to provide feedback. As industry knows, they don't get to call all the shots. Of course, we're going to do our jobs and we're going to ensure that the policy objectives of the legislature are appropriately realized and carried out. But we want to know what your feedback is. We want to know what your thoughts are. You live this in a very, very practical way every day, and that feedback is valuable, even if we don't agree, although oftentimes we do. And the result of that collaboration is the rule is much better and effective. The bulletin is much more effective. So we value the collaboration that we have in that process. So again, Senate Bill 173 will have new rules, we'll have a bulletin, and we'll have guidance. One piece of legislation that did go forward this session that I didn't highlight because it's incredibly complicated. We could have an entire webinar just on PBMs. One result of this legislative session that is important to highlight is the department is going to be asking for an increase in the amount of information that we ask PBMs to provide. We're going to take a look at that information. We're going to handle it appropriately, of course. We're going to ensure that confidentiality is maintained. But the legislature asked us to get more data, get more information, and then in a broad way, in an anonymized way, in a way that aggregates all of that data, report back to them what we're seeing in terms of trends and in terms of costs within the PBM world. Dr. Jason Azes, again, our Director of Health Analytics, could host an entire webinar, probably go on for hours about this. But he is in the process right now of working on a bulletin that's going to detail to industry how the department wants that information to come into us in terms of how it's reported, in terms of the format that we want it in, and in terms of how that information is to be submitted. So for those of you who have an interest in the PBM space, know that that's coming. Again, you'll have an opportunity to provide feedback. The prior authorization reforms that I talked about earlier, those will also necessitate us promulgating new rules, and there will be guidance as well. Those rules are currently being drafted, and we expect in the next several weeks that we'll have something out to industry for comment as well. And so those, I believe, are the follow-ups on the big items that came out of this legislative session. I think that's quite enough. The only other thing that I would highlight in terms of the ongoing work is, and in a sense, it has a certain appropriateness to it that I'll kind of end this part of the program where I started. The last frontier of medical care that consumers are not protected from balance billing with is ground ambulance. And we had a robust conversation with the legislature this past year about ground ambulance, the challenges that are facing the ground ambulance providers, how that is manifesting itself in contract negotiations with insurance carriers, and what we can do to try to protect consumers from these types of bills. So again, we could do an entire webinar on this. We might have, in fact, they all kind of blend together after a while. But what the department is currently working with New Hampshire Health Plan on, as well as some other state agencies and ground ambulance providers, is to get a cost study as to what the costs the ground ambulance providers are facing and what the appropriate rates to be reimbursed from commercial insurance carriers might be. This has been a multi-decade long disagreement. It's an unresolved policy issue that has major implications for consumers. And so we're going to try to bring actuarial science. We're going to try to bring more data to the table to see if that might not help policymakers towards a good solution here, again, to protect consumers while respecting the fact that our ground ambulance providers are valued members of our healthcare infrastructure, but also understanding that the burden of the financial challenges those providers face cannot be layered entirely on the backs of insurance carriers, because ultimately it will get layered on the back of the consumer. So that's an ongoing project. There's going to be a lot more to say about that, but our team is working very, very hard on that study. We have a late fall deadline from the legislature on that, and we will make sure that we hit our deadline, and we'll be able to talk a lot more in depth about it at that time. So the very, very last thing that I'll mention, kind of transitioning from what has happened and what has already taken place to what perhaps may take place legislatively in the future, I would highlight that I hold here in my hands several pages worth of potential legislative initiatives that the department is thinking of bringing forward for the legislature's consideration in 2025. What I would tell you is, as of this moment, we believe that we will be bringing forward 6 department initiatives. One of those initiatives, so one of the 6, will be a technical correction bill that will have a wide array of cleanup. It'll just be tweaking some things here, tweaking some things there, making some things a little bit more clear. I don't foresee there being too much of substance that might get anyone in industry concerned. And then there will be 5 initiatives. Vast majority of them will be in the life and health space. We're finalizing those proposals right now. My team had a deadline of last Friday to submit to the leadership team at the department their draft, the actual proposal that they'd like to go before the legislature, the draft bill. And now our legal counsel and the leadership team will take this week to review that work, make any edits or adjustments to the drafts that we've received. And it is my intention that the proposals the department is going to strongly consider bringing forward next year will go out to industry for feedback and comment next Monday, September 30th, so a week from today. If I'm off a day, please have a little bit of patience with me, but it will be coming very, very soon. So you'll have a good sense as to what the department is thinking for next year. And again, we welcome and value the feedback that you'll provide us on those proposals. We are trying to keep our department initiatives few to provide us with bandwidth and flexibility to be able to be responsive and helpful to the legislature. Obviously, there's an election coming up in November. You might have heard about it. There's been a thing or two on television about the election. But obviously, that's going to bring forward a new legislature. We're going to have a new governor, one way or the other. So we're trying to manage our workload to, again, make sure that we have the bandwidth to help legislators who may bring their own proposals forward to assist the new governor in any initiatives or priorities that she might have. So we're trying to keep our initiatives to a minimum, as I said, to appropriately manage our own workload. So you'll find out more about that, as I've mentioned, a week from today. So at this point, again, I'll turn it over to my team. If there's anything that I've missed that they think is worthy of highlighting, please do speak up at this point. Hopefully I've done all right conducting this webinar from my car. This is a first for me. Hopefully it's going all right.
So Commissioner, you did a great job. There was one question that did come in on the chat line asking about House Bill 1259, which was one of our P&C more technical bills relative to auto glass replacement, and maybe Director Fox can kind of give us a quick overview as to what that means for individuals adjusting glass claims.
Okay, well, yes. So it's very simple. If you're solely adjusting glass claims, you don't need to have an adjuster's license anymore in the state of New Hampshire. We don't think it's a complicated enough adjustment that it needs a license.
Thank you.
Wonderful. Have any other questions come in?
No, there have not been any others.
Wonderful. All right. Well, I appreciate everybody taking some time today. We're obviously already getting ready for the next legislative session, but I think that it was important for us to provide a bit of an overview as to what took place this year and what's going to go into effect come January, and how those changes might affect you, whether, again, you be in industry, whether you be a producer, or whether you be a consumer. So hopefully you found this webinar to be useful for you. I know that AJ's provided information to contact the department in the event that you have additional questions or concerns or ideas and feedback. We love all of that stuff, so please do keep those inquiries and outreach coming. But with that said, we can stop here, and I look forward to seeing you all again next month for our webinar series. Thanks so much.